Gareth Presch. He is the founder and CEO of the World Health Innovation Summit, also an SDG 3 thought leader, and I'll get him to explain that. And given that we're going through COVID-19 and Gareth has connections right across the world in public health, as this is his area of specialism, I thought we'd better get him on the show. Gareth, thank you so much for joining me.
Oh, it's a pleasure to join you, and I'm delighted to be able to speak to a fellow Irish, shall we say, citizen of the world.
Absolutely. And the last time we were in person together, it was in Brussels outside the European Parliament.
Yes, it was. I remember it well. It was raining very heavily that day.
So listen, first of all, let's just explain to people what an SDG is, because this is quite an important part of your work.
Yeah, absolutely. So the Sustainable Development Goals were decided by 193 heads of state in 2015 as a kind of roadmap, as a kind of compass. There was previously the Millennium Development Goals, and you'll see this symbol here that I have in my jacket. That represents the 17 SDGs. And I suppose my role is focused primarily in SDG 3, which is good health and well-being. And as part of the 2030 agenda, you'll have seen, various entities picking up on SDGs. But our role, I work with the UNGSI Foundation, which is the foundation that was set up by the United Nations Director General Michael Muller, with Roland Schatz and previously with Kofi Annan, to implement the SDGs. And they have a front runner program, which is why I was in Brussels with the European Commission at that time, to explain to them what the 25+5 cities initiative was about. And as I said, my role with the World Health Innovation Summit, it's identified as the platform for sustainable healthcare. And so it's to bring that knowledge, that content to these cities and to help them improve people's health and well-being.
Now, what you've been working on in terms of health and well-being and globalized health and systems, now it's a very relevant conversation, and now all of us are interested in that. What has been your role in COVID-19, and how early in its outbreak were you involved, given how you move in the circles that you move in?
Yeah, I mean, I'm very fortunate. I'm very lucky that I work with some, exceptional people. I'm grateful for that opportunity. But we kind of share information across all the digital platforms, and we're in contact, on a daily basis. And so when it was first reported in January, we started to kind of take a look at this COVID-19. Look at the background. We had our SDG lab in Davos. We briefly discussed it with some colleagues around the table, but it wasn't really, I suppose, until mid-February when we began to start looking at this very closely, as the numbers began to rise in China. And, we wanted to get an initial understanding of, what was happening. And then we began to mobilize our network around how could we support through PPE, decontamination, put together a strategy as well, in order to, help flatten the curve, as they say, and raise the line, which is the capacity within the system. And then look at the next steps, which is, how do you prepare for post-COVID-19? What lessons can we learn? I think this is an example of how vulnerable our system is at the moment.
So as most of us are in some sort of lockdown in over 200 countries, how were you able to continue with your work and have those really important public health conversations?
Yeah, I'm again, like yourself, I'm very flexible in terms of my work. It's mainly online, so I just need digital connection. So, I'm at home at the moment, and I can work from home. So I keep in touch with everyone online, so I was explaining, we have teleconferences pretty much most of the day, WhatsApp, Zoom, Facebook Live. We had a Facebook Live, on March 19th with Dr. Amir Hannan, our chair, and we kind of explained to the general public what COVID-19 was about and kind of the measures that they could implement for social distancing and so on and so forth. So that's how I keep in touch.
So what's your view on how COVID-19 and coronavirus conversations are happening online? There's some very divergent views. So for example, here in Ireland, we have our Minister for Health, our Taoiseach, and also our Chief Medical Officer asking people not to look at social media, but ultimately people are going to look at social media. But what has been your view just as an observer of online conversations?
Yeah, I mean, I do follow Ireland quite closely. I mean, I think they've taken some great steps, you know, initially with the lockdown, and they moved very swiftly. In fairness to them, they took some exemplar examples. And if you look at how well they've done, I mean, the proof is in the pudding. And, you know, for every 100,000 people, you know, it's 6.6%, I think, roughly. And it, you know, debt rate, shall we say. And in the UK, it's about 14%. Like, it's a lot higher because Ireland moved very quickly, you know, to suppress it, to flatten the curve and put in the lockdown. So hats off, they've done a great job. But I think it's been very interesting to follow social media. I think there's some good information being shared on social media in some respects. You know, I mentioned the Facebook Live, a great opportunity for health professionals to engage on those platforms. What I'm surprised with Facebook Live is I don't see as many, shall we say, engagements from the public sector on that platform that could be used to engage with communities. I think that's one of the areas that we have a lot of, should we say, skills in. And there's definitely scope to improve there. There's good podcasts out there. Dr. Shan Hassan, for example, he has, you know, his own podcast series. And, you know, NHS, as I said, HSE in Ireland, they're doing a pretty good job along with the GMC, National Institute of Health and Research, EU agencies, the UN agencies, WHO. You know, they're doing their best to get as much information across online as possible, but I do think they're slightly behind the curve in this respect.
I guess their conservatism is now showing and coming to the fore, but I guess as the situation prolongs and it's going to be protracted, we may see more of them hopefully on social media and doing those Facebook Lives. Now, I've had the opportunity to have a read of your recent paper that was launched on Corona Perspectives. What does it examine and what are the main conclusions? Because I know it's literally just hot off the press.
Yeah, absolutely. So I mean, since COVID-19 started, the most important thing is, you know, is to ascertain the facts, you know, and to study, you know, evidence-based material. So as COVID-19 has escalated, we have been trying to support our shall we say, partners. So they asked us, could we put together this newsletter, you know, for the likes of the Vatican, faith communities, UN Academic, African Union, SDG cities, the Interparliamentary Union, which is a very important agency. And what we've tried to do is put a perspective on this from the point of view of, you know, ascertaining the facts so that these key decision makers can flatten the curve, raise the line, and prepare for the aftermath of COVID-19. It's really about putting the policy around what happens next, because these are very key decision makers. You know, if you take the Vatican, for example, you know, they are in control of 26% of the health economy worldwide. You know, it's enormous, you know. And then, you know, so UN Academic, they've 1,300 institutions, you know, African Union, you know, so there's a lot of key stakeholders that we're trying to support. So that's the purpose of the COVID-19 perspectives. And it's also translated in multiple languages, you know, Spanish, German, French, Chinese, for example.
So the incidence of COVID-19 in healthcare settings is a serious issue, and it's a trend that we've seen here, particularly in Ireland. Another trend that I've noticed also is that we have our healthcare workers now using social media more, nurses, doctors, frontline staff, appealing to the public to stay at home, to observe the social distancing guidelines. I think they're making more of an emotive impact as messaging fatigue sets in. Do you think that real people telling real stories from the front line can help?
You know, something you really touched on, a great point there. You know, absolutely. You know, it's heartbreaking to see colleagues online going through these very difficult and challenging times. But I do think you've touched on something that's very relevant here. It's about that professionalism, and it's that emotive side of things. And we do work in the health system. We're there, you know, they're 20 years experience. Unfortunately, death is part of our business. It's part of the job we do. I've had experiences myself, you know, with sudden cardiac death syndrome in A&E departments, and it's very traumatic, you know. And I really do feel, because of the situation the current system is under, it's under so much pressure, and it has been under pressure for a long time. this is almost like a powder keg, if you get me. The floodgates open up, and I think there's been a lot of good points made online about the aftermath of COVID-19 and the effect it will have on the staff, and that's what we really need to look at now. Is in the future, how are we going to protect the mental health, well-being of these staff, who again have trusted themselves into the limelight, and how big, social media, you see some of the stuff that's going out there, you're getting a lot of hits, you're getting, millions of people, and now they're in the public limelight. It's a different shift, and it's something else they have to learn, because you get trolled, and so there's a lot of learning here, but I hope we can really help them in that situation.
Now, I want to ask you a question, and this is not to scaremonger in any way. It's just because I know the depth of knowledge that you have around healthcare and globalized healthcare systems. From your perspective and knowing what you know and operating on the global health stage, what's your biggest fear right now about COVID-19, especially around communications? Because there's different perspectives depending on what country you follow. And I'm following lots of countries, obviously, because I'm analyzing it from a communications and a digital perspective. While we're all in it together, and that's a phrase that has come out, there seems to be no consistent view. Obviously, we're following the guidance of the World Health Organization, but we even see the United States withdrawing their funding for the WHO. So, what's your big fear right now about the comms that's going out there and the divergent views?
Yeah, I mean, the first and foremost, it's about, unnecessary loss of life. I think we've got to ensure that we take appropriate action fast, and that we learn and share the lessons very quickly. And it's a difficult job. It may sound easy, but it is a difficult job. So I really hope we can look at COVID-19 and learn from that experience. We've had pandemics in the past. I think one of the biggest lessons here is, were we prepared? Could we have done more? And we need to get a global system in place where we're able to share that knowledge very quickly and very effectively. The alarms, the triggers, because be under no illusions. I mean, people need to understand this. We are going to face some serious challenges over the next couple of months and years in relation to staffing and recruitment of our health services, which is, should we say, we're facing 18 million by 2030. That's a huge problem. And there will be other pandemics, so we need to be prepared. And I really do hope that we can, we don't compromise safety standards. We don't compromise the quality of patient care, and that there's not any unintended consequences from some of the decisions that we've made, because we effectively have revolutionized healthcare to telemedicine like that in an instant. Now we need to ensure when we get the time to sit down and measure this, that we put in place, the methodologies that don't have any unintended consequences, and no further lives are lost.
With every global, conversation, there will always be conspiracy theorists. And only in the past week, YouTube have announced that they are removing conspiracy theory content. So conversations around COVID-19 and the link to 5G technology. What, in your mind, is the antidote to these sort of conspiracy theories? How can we kind of flatten that curve, if you like?
Yeah, absolutely. I think this comes down to education. And I think the more that we can get scientists to step up and to have those conversations with the likes of yourself and with the general public, that's the best antidote. I don't get involved in that space, to be perfectly honest with you. I ensure the information that I look at is based on evidence-based, and it's from a reputable source. I mean, there's a couple of basic principles. There's a lot of good information out there now online from Fact Checker and so on and so forth. But, if you look at some of the publications from, trusted sources, it's all about the trust. And I mean, that's really where you should be following. So that's my advice in that space.
Yeah, and you're right. We need those experts to step up and become digitally native and digitally agile to be able to have those conversations. Another group of people that you mention in your white paper is the unseen governments with parliaments shut down. That really caught my eye. Obviously, they're shut down for very good reason. However, is there a sense that we're not seeing enough of our leaders, and are they not showing enough leadership? What's your perspective from the international scene, I guess?
Yeah, I think, look, we're going through a massive digital transformation. So there's an opportunity here for governance structures to move with the times. You can see how quickly things are moving. The majority of our governance is set up on a, shall we say, 1800, 1900 structure. So we need to look at how do we govern for the future. The SDGs is an opportunity, but in this context, we talked about the scientists. I think it's also about the parliamentarians supporting the scientists as well, and showing a united front. But also, there's a great opportunity for those members of parliament who work exceptionally hard for their constituencies to stand up and to show what they do. They work exceptionally hard. They work long hours. They deserve credit for that. I don't think people realize the amount of work that these people put in, because they work exceptionally hard. You see that with the ministers, in Ireland, they're doing their very best. They need a lot of support. And I think we need to also, credit that, and say they need help. It takes guts to stand up in front of people and to lead. It's not an easy job. It's easy to knock someone, but it's difficult actually to take that leadership mantle, and we need to support people like that.
Now let's look ahead, because we have to have hope in a looking ahead to a post-COVID-19 world, if that will even exist now, the fact that this virus is here. What's your view, and what about a possible vaccine?
Yeah, well, I think, you can't step out of a river and then step back in the same spot. So I think we're it's, no matter what happens, we're going to have change, and it'll be drastic change, I would imagine. I do believe that this shows how vulnerable we are in terms of our health systems. We'll need to sit down after this and do a review. I think the opportunity is in the community, as I've explained, through some of the programs that we run to support people's immune system, boost people's health and well-being. I think we have to look at prevention now at scale, and that's got to be the future. It's got to have a real relevance. In terms of, should we say, a vaccine, you're really looking at, I think, realistically, 12 to 18 months before you get a vaccine out there. Hopefully it's before then. I know there's some very interesting studies going on at the moment in Oxford and other areas. They may get a breakthrough. There's a lot of people focused on this. So hopefully the collaboration works, the sharing of knowledge works. But I think a vaccine is certainly a number of months away.
So how have you been coping then during the lockdown? Like me, you're used to the international travel and meeting a lot of people in real life, in person, and you're in the UK at the moment with your family. So how are you managing your own mental well-being?
Yeah, I think being busy helps me. I think it's a really important thing to be busy, keep a schedule. I tend to be, like yourself, kind of up early, late at night working, but I also do get quite a lot of balance. So I will take the kids out for a bike ride earlier today. For example, I take an hour out when I need one. I also, I run. I find that, very, should we say, stress relieving for me. And that's how I manage, my own health and well-being. And I try and eat well. That's key for me.
Gareth, always a pleasure to have a conversation with you. Thank you so much for joining me on the Public Sector Marketing Show. And I will share links to your website and your platform as well. And maybe we can share that white paper as well. I think it'll be a very valuable read for people.
Very welcome. It's been a pleasure. And thanks very much for having me, Joanne. It's been such a pleasure to join you.